Hi, welcome to another one of our Dr. Foot videos. In this video, I'm going to be talking to you about one of our orthotics. Now, as many of you know, I am a podiatrist. I invented the Dr. Foot Pro Insoles, which are these insoles, about 15 years ago. And the reason why I created these and I invented them was I found difficulty in finding orthotics for my patients that were suitable. So I was either getting orthotics from suppliers that were too soft, or they were too rigid, they were plastic and they were really uncomfortable, which is why I set about creating a range of Dr. Foot orthotics. So I created 9 different orthotics. These particular orthotics I really like. So these are the Dr. Foot Pro Insoles. They're a 3/4 length orthotic. They have a semi-rigid arch support, which is also very, very comfortable. It has a comfortable top cover and it has a pour-on heel cushion to redistribute shock at the heel. Now, these orthotics can be used without any additions and they will really help anybody with arch pain, discomfort, heel pain, and a variety of different other conditions. However, the beauty of these orthotics is when you go to purchase these online and you go to drfoot.co.uk and you go to the page for the Dr. Foot Pro Insoles, you'll get a series of different options. And I'm going to go through a couple of different options that you can use for the Dr. Foot Pro Insoles. So, firstly, you can actually add a heel wedge on the inside. This is a heel wedge to further lift up the inside of the heel. If you are suffering from plantar fasciitis, which is inflammation of the fascia, add this option on. It will really benefit that condition. So you can get either 2 degrees or 4 degrees. I would also recommend adding a lateral, which is on the outside, 4-foot wedge, which will also aid the windlass mechanism, which is what your arch uses as you walk, and really take some of that pressure off the plantar fascia. So these 2 options will be great to add if you're suffering from plantar fasciitis. If you have flat feet and that's causing a problem, you can also add a medial arch wedge, this heel wedge here. I think that's option 1, and I would choose 4 degrees for that. You can also, if you add a metatarsal raise, so if you're suffering from Morton's neuroma, which is when the nerve in between the toes becomes swollen or irritated, you can choose to add in a metatarsal raise. If you want it to be more towards your big toe or more towards your little toe, drop us an email and ask us to, can I have this more towards my 3rd or 4th metatarsal or more towards my 1st and 2nd metatarsal. But what the metatarsal raise will do, it will raise up the metatarsal and take pressure off that nerve. It can also be used for any type of pain in the ball of the foot. It can be really helpful. This is a Dr. Foot Pro insole with a wedge on the outside of the heel. Now, I don't like the term overpronation, oversupination, but if you find that your ankle rolls out too much, that's excessive moments of oversupination. It can also lead to ankle sprain. So if you're more prone to getting ankle sprains, then having a wedge on the outside of the orthotic can really help. Obviously, you need to also include rehab exercises to make the other structures around the ankle stronger, but having a wedge on the outside of the orthotic can really help. We can also add in a medial flange. So this is a medial flange. All these options are on the Dr. Foot Pro page. There's also, you can reinforce the arch. So I've actually created all these additional add-ons I've created myself. So this is a reinforced Dr. Foot arch. And you also have a red wedge here. This is for a patient who had really quite flat feet and needed quite a lot of support in the shoes rather. and this gives you a lot of support. This medial phalange actually isn't hard, it's quite soft, but it just gently lifts up the arch and gives you a little bit more support. And some patients need that. Some patients need just a little bit more support to try and stop them from rolling in their ankles a bit too much. What we can also do is, let me find it, this one here. You can also add a top cover on. So we have various different top covers, and you can choose to add in a top cover for extra padding and cushioning. One of the other options you can add on is an extra heel cushion. So if you're getting heel pain, you may want to add in an extra heel cushion. If you have any questions regarding your foot condition and your foot pain, and you want to choose the right type of options to go on the Dr. Foot Pro Insoles, drop us an email, ask us. One of our podiatrists will get back to you as soon as possible, and we'll be able to give you advice based on the email and the symptoms that you've described, and we'll be able to advise you what options are best suited for the Dr. Foot Pro Insoles. The Dr. Foot Pro Insoles are sold from extra small to extra large, so they cater for all shoe sizes. The extra small are really good for children also. And because they're not really rigid, they're quite comfortable to wear. So I find that a lot of my patients really benefit from it, and we've been retailing these all around the world for the last 15 years with great success. We've got medical professionals all around the world that love the Dr. Foot Pro Insoles and that recommend them. So if you have any further questions, please email us or visit drfoot.co.uk, and I hope this video was helpful. Thank you. Bye.